At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Oh My Aching Back on Wednesday, July 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
At the Roselle Center for
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome. This is Dr. Tom Roselle, and you're listening to Dr. Tom Roselle Live. Welcome to the program. We've got another great, eye-opening, interesting, let's look at these type of things program for you today. Anyway, hey, listen, let's get into the fact. Don't forget, coming up the 16th, which is about 3 days from now, Wednesday evening, 6 p.m. at the Roselle Center for Healing in Fairfax, Dr. Harlan Browning and I will be presenting a night on your low back and why you have chronic pain, why it never goes away, what you can do about it. We're going to give you some things that you can take home and do. We're going to show you the multidimensional pieces that affect your low back. We'll talk a little bit more about that today, but I want you to join us because this is a problem that is devastating financially to not only you, because you can't work when it happens, but also the productivity and the national product, if you will, in this country. And we'll talk about that just momentarily, ongoingly. There's a lot of information that's out there right now on the MAHA movement, right? Make America Healthy Again. By the way, I went to a conference about a week or so ago, and I had my MAHA hat on, and it was funny how people would look at it. It's a really good conversational starter because then I can say, I'm a doc, this is what I do. I'm a chiropractor, acupuncturist, nutritional guy, and so forth. And, this is what I look at. And it really allows you to, to talk to folks. And it's important that we understand the facts. So we're going to talk about the facts today. We're actually going to talk a little bit about synthetic dyes. There was an article that just came out and it said that, MAHA, through Bob Kennedy, it will ban synthetic dyes across the country 100%. And as far as I'm concerned, that's exactly what needs to be done. The synthetic dyes, the artificial food dyes, can cause all kinds of problems. If you go in and you research it, they're going to say the research on whether these things can cause cancers and other kind of conditions are inconclusive. So when you read inconclusive, understand that there's going to be people that are going to take an opposite position, and there's going to be people that are going to say, look, the research, the data, statistics show that there's a huge percentage that must get your attention, and you have to be aware of it. If you don't pay attention to it, you're doomed, if you will, to being one of the inconclusive pieces of information or data that is going to come back and, when they tell your family, sorry, there's nothing they can do about it, that's the way it is. But let's get into that just a little bit before we get into the low back problem. Artificial food dyes, there's a bunch of them. And you go, red dye, I think 40, and red dye 1, and so forth and so on. It's craziness. It's an ongoing crazy situation. Yellow dye 5, yellow dye 6. These are commonly used in processing foods and beverages to enhance their appearance. So it's an appearance, it's an appeal, to your eyeballs and to get you to say, oh, that's cool, right? So as a health professional, many of our patients come to us and they ask the question, are these things linked to hyperactivity in children and allergic reactions and cancer and intestinal tract inflammation and other system inflammatory reactions? The short answer is, based on my experience over 4 decades of healthcare, almost five, coming up in another year, is simply this. Yes, we have seen reversals when we've detoxified and taken these things out of young children and they calm down. And we see that people can begin to reverse problems that seem to be chronic when they're eliminated. So, what are food dyes? And what do you have to really know about them? Well, they're commonly added to your food during processing, and one reason, and the primary reason, is in parts color, and they're used to enhance the appearance of food and make it more appealing and seductive to you, if you will, so you can go buy them. And food dyes add calories to all kinds of things because there's sugars in them as well, and then candies and snacks and beverages and so forth. So they're more attractive to you. But some of the most common food dyes, if you will, are, as we said a moment ago, red dye 40, which is called also Allura Red, blue 1, which is brilliant blue, yellow 5, which is tartrazine, and yellow 6, which is sunset yellow. So these are not natural dyes, but if they use the natural dye, they're extracts from plants or animal sources and are typically far more expensive and may add an unintended taste or flavor. So they use these chemical sets to, give it a color. An example of a natural dye would be something like beet juice or turmeric or paprika. And if they put that in there, obviously they have a very specific taste to them. So what do you have to worry about? Well, you got to worry about that there's an impact that takes place. Now, hyperactivity, going back in the day, this goes back to the 70s, uh, with children, is one of the most prominent tie-ins when it comes to food dyes. There was a guy by the name of Feingold. His name was Dr. Ben Feingold. And he was a pediatric allergist, and he proposed a link between food dyes and hyperactivity and suggested that eliminating food dyes from children's diets improved the hyperactivity behavior. Well, it was true. It did. And we used it as part of a standard protocol early on when I first started practice, before I knew what I knew today. And we've, added on top of that. There are tons and tons of studies out there that looked at the linkage between artificial dyes and hyperactivity in children and learning problems of all sorts. In the 90s, early 90s, there was a short-term, if you will, elimination diet, and they did it by guess and by gosh. And they found that there was a 73% improvement, 73%, it's huge, in ADHD symptoms by removing dietary food additives across the board. Well, if that's true, then why did we send it aside? We had to have more studies, right? So in 2004, 2007, this came out of a British Food Standard Agency, FSA, and they found a link between the consumption of 6 types of food colorings and hyperactivity in children. Now, this is straight up. So if that's the case, then why aren't we as aggressive as the Europeans were? And that's 20 years ago, right? Approximately. And the European Union has a broad policy that says you got to have a warning label on products containing any of these dyes whatsoever. And in every country, including, there was an Irish study going back in 2010, and same type of situation. And all these are available to you. So why are we ignoring them? It comes down, my opinion, old Dr. Tom Roselle and his big mouth, it's about money, honey. And it's about who's, going ka-ching and, supporting, whoever's election process. And did I say that? No, I didn't really say that. So I'll let you deal with it. Cancers, same type of thing. Research whether food dyes are causing cancers. Then you see that big inconclusive statement come out. Well, inconclusive maybe, but we're seeing all kinds of kind of linkages, if you will, between that. And then you have irritable bowel disease. They found that Crohn disease and ulcerative colitis as well may be directly related to. And that was a study that came out of Canada only a few years ago. And they were talking about red dye 40, Allura Red, remember? And the impact that that has. But these dyes have a very direct impact on your good bacteria. It's called your microbiota, all right, in your intestinal tract. And if you have a genetic susceptibility, then it increases the problem and the potential of, oh my God, I have irritable bowel, I've got cancer, I've got a bleeding this, I got a bleeding that. Chronic exposures to these dyes was associated with gut barrier disruption and alterations in serotonin. Serotonin is a neurotransmitter. That's a feel-good neurotransmitter. Why do we worry about it with your gut? Well, because your intestinal tract produces 75 to 80% of the serotonin that your brain needs. And it said, well, you say, what? Yeah, you heard me right. Whatever goes in your gut has a major impact on everything else. So listen, pay attention to this stuff. Don't set it aside. If you like your body and you want to live a long time without all kinds of problems, and we're a world right now that we're, particularly in this country, we're a sick society. And I don't mean that emotionally. There's an argument about that. But what I'm saying is this, is that we are more susceptible. We're way down on the totem pole when it comes to overall health, and we spend a whole lot more money than anybody else does when it comes to these situations. There's a huge bunch of references. One of the better ones that I've read recently, and it was a publication that came out 10 years ago. And it's I'm going to quote from this one. It's called The Psychology Impact of Food Coloring. The Psychological Impact of Food Coloring. And it was written by somebody called Spence, Spence. And you can find it pretty easily. But there's a host of this type of stuff going back years and years and years, and we've ignored them. And why have we ignored them? Again, my opinion is somebody's profiting. There's ways of, going through this stuff, but don't be duped. Don't look at it as, this doesn't exist, because you're going to be one of the statistics and you're going to wonder why it happened. Well, I'm here to tell you why it potentially could happen. And, at the Roselle Center, we know how to find these things. We know how to test them. We know how to desensitize them. We know how to get you off of the problems. If you think that you may be having a problem with this, and then compound it on the vaccines and the exposures and the spike proteins, now you got a real problem. So let us help you if we can. But this coming Wednesday evening, let's get into that a little bit. Going to join Dr. Harlan Browning and myself, and we're going to be talking about low back pain and all the things that can come about or cause it or trigger it and so forth. So, what does low back pain have to do with anything that we're talking about? Well, actually, if I wanted to really get into it right now, there's a lot, but we're talking about one of the most costly problems in our society. Did you know the cost of treating chronic low back pain, including the expenses related to diagnostic imaging, CAT scans, x-rays, the medications, the procedures, and so forth and so on? In America, in this old country, good old US of A, back pain costs businesses $1,685 per employee, whether they have back pain or not, every year. And it costs the company and you, so it's a combination, due to what? Lack of productivity, sick days, and so forth. So even though that you may not have back pain, the cost, when it's spread across the board over all of us, it's costing the company $1,685 per employee every year. You want to drop prices? Let's get rid of back pain. It's one of the things that we have to do. But think about what it's costing you. If you have back pain, you don't want to do the things that you have to do around the house. Can't go mow the lawn. Can't go into the garden. Can't make the bed. Now you got to get somebody else to do it, or it's going to look like what? A shambles city, right? So we can compound that exponentially. We can't produce it. We don't feel like doing that. But chronic pain is a major problem in the United States, but particularly low back pain. If you look at the articles that are out there and you look at the severity levels, if you will, of and break it down economically that way. So you go to mild, chronic, low back pain. Mild, what does that mean? But they put it together with chronic. Chronic back pain can vary significantly in its intensity and impact on your life. But you got to understand what it is, right? So a mild back pain, right? It's called pain and stiffness and soreness in your lower back. And it can be because of all the things we've talked about over the last several weeks. It can be dietary patterns. It can be emotional stress and strain. That emotional low back pain, that could be your feelings not handled correctly causing the problem. That gut feeling, your intestinal tract, that gut feeling, that's where the term came from. And it refers back into the spinal system. But you can have this pain that comes and goes, the stiffness, the soreness, and so forth, but it's ongoing. It's chronic, and the risk factors are numerous. Diagnosis, they're going to send you out for a lot of stuff because they don't know what the problem is, but it has to do with spinal systems not being aligned properly. It can be because your feet are off balance, and as I've said repetitively, the ankle bone's connected to the knee bone's connected to the back bone's connected to whatever. Those types of things are ongoing, and if not corrected, they can cause degenerative disease, and it gets progressively worse over a period of many years. Chronic low back pain at a moderate level is a little differently because it's more painful. The pain is frequent, and it still has the same thing, reduced flexibility and so forth, all those kind of things. But it's usually an inflammatory reaction that is involved in that. But again, due to the same things, structural imbalances, overzealous waistlines, no activity levels, and chronic postural positioning. So if you're sitting in the same thing all day long, you go to work, you can sit in a chair. You get up, you go to your car, you drive home. You get out of the car, you go inside, you sit in front of the television. What are you doing? It's a problem. It increases your risk of spinal stenosis and herniated disc and spinal tumors, things of that nature. What do you mean, risk of spinal tumors? Well, if you don't get blood supply, if your inflammatory level goes up, the body begins to develop things that you don't want. So we have to make sure that we treat it properly. The medical approach is going to be all kinds of strong medications, interventional procedures like they're going to inject in your spine. They're called epidural injections. Those are steroid-like substances, my friends. So when we have that moderate problem, we're into medication heavily. Now, when we get into severe problems, then we get into heavy duty testing, and we're getting a lot more CAT scans, and we're doing more blood testing and MRIs and so forth. And the medications that they're going to use at this point are significant, and they're addictive. And we become a country that is drugged out of our minds with all this stuff that they're putting in our system. If you want to get rid of this stuff, if you want to learn how to take control of it, if you have the nerve to make some changes, join us this coming Wednesday evening, the 16th, at the Roselle Center for Healing in Fairfax, 6 p.m. And I promise you, you're going to walk away with a ton of data. And if nothing else, I may end up saying some things that's going to get your attention. You're probably mad at me for a week, but then you can say, well, he's probably right. Am I going to do something about it? And you'll have that opportunity as well. So join us. Seriously, join us. All you got to do is go to rosellecare.com or drtomroselle.com. If you'd like to do it the old-fashioned way, real simple, 703-698-7117. That's 703-698-7117. By the way, just a sidebar, these programs are our gift to you as a community because you deserve the information. You need to have the data. you need to be able to do self-assessments. You need to be able to ask your doctors the right questions to make sure they know what they're talking about. And you can always get a hold of us. You can call us, you can talk to us, you can do all those things as well, but you have to have the information. You have to be your own advocate. Health is a do-it-yourself program. Don't play with this. It's not okay. You're not setting yourself up for a great life. You don't lift your grandchildren. You don't, somebody has to put the baby in your lap, because if you stand up with the baby in your lap, your back is killing you. You can't go outside and teach your son or your daughter how to do yard work because you don't have the strength, and you fatigue, or you hurt, or you have numbness in your legs. When you follow me right after the program right now and going into the live stream, I'm going to show you a couple things that you never thought about. I'm going to show you how hamstrings, your back of your legs, are a major problem if your gut's not working. And that causes your low back pain. I'm going to show you a couple other things like that as well. I'm going to show you where it comes from. So go to drtomroselle.com, or if you're following me, as you should be, on all kinds of social media. I'm everywhere, right? From Facebook to Instagram to X to, I'm there. Follow me. Then we'll let you know, right? We'll let you know when it's going to happen. You can pick it up anytime. We republish it all the time. This information is critical if you want to have a decent life. Reversing your life can happen as long as you're breathing. As long as you're breathing. Because cells are replacing themselves ongoing. So if that's the case, why don't you make a decision to get all the data that you need to get? Why don't you make a decision, that, enough is enough already. I want my life back. And there's nobody better than these brilliant doctors that we have at the Roselle Center. These guys are amazing, and particularly Dr. Harlan Browning, who you're going to have the privilege of talking to. We're coming up to the break. Don't forget, follow me right now, immediately. I'm here every Sunday for one reason only. I love you all. You have a great Sunday. Let's go. Let's finish up the program.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
you.